Hi everyone, it's Dr. Jeff here today. Today we're actually talking about sleeping and back pain. I get a lot of patients coming in and they talk to me about having a really stiff back when they wake up in the morning. That can be caused by two things. Number one, it's your bed. If your bed is more than 10 years old, chances are it's not supporting you the way it should support you anymore. When you sleep, the idea is you want to support the natural curvatures of your back. So you have a neck curve, a mid-back curve, and a low back curve. You want to protect those when you're sleeping. And your bed may not be doing that anymore. Number two could be the way you're sleeping. And to help us with that, Rachel's going to help us today demonstrate our sleeping positions. Number one position to sleep in, which I advise you not to sleep, would be on your stomach. Because when you sleep on your stomach, if you notice, she's very flat here. All right, there's no curvature here. There's really no curvature. Everything is flat. Plus, most beds don't have a place to put your nose. So you have to turn your head to one side to breathe. Because we are creatures of habit, we generally turn to the same side all the time, causing undue stress on one side of the neck versus the other side of the neck. People that sleep on the stomach generally have a problem with the C6-7 disc or the L5-S1 disc. Research has found that 80% of people with carpal tunnel syndrome are generally stomach sleepers. All right, so sleeping on your stomach is not a good idea. All right, good position to sleep would be on your side. So we lie on our side. The idea is you want to support the curvature of the neck. So we're actually putting a pillow in to support the curvature of the neck. If you're looking at Rachel here, her knee is actually leaning forward here, causing a twist of the pelvis. So we want to put a pillow between the knees. That way we're going to keep this level, and we're not going to be rolling forward. So we're not going to be putting undue stress on our pelvis. Right? So that's a good way to sleep with something like this. And you want to avoid putting your arm up over your head like this. When you do that, all right, you're rolling forward, putting a lot of stress between the shoulder blades, and that can lead to a stiff neck and stiff shoulder. The other way to sleep would be on your back. On your back, again, we want to use a proper pillow for supporting the neck. All right, we put a pillow under our knees. When we do this, we actually let the pelvis rotate forward. That causes the back to go into lordosis, which is a natural position for it, so that relaxes the muscles. Same thing with the neck. We're allowing the muscles to relax in the neck, and that's what you want when you're sleeping, is the muscles to relax, so that when you wake up in the morning, they're not stiff and sore. All right, thank you, Rachel, for the demonstration. So when you're sleeping, all right, sleeping on your stomach is bad. All right, and sleeping is a habit. It's a habit that can be broken. All right, sleeping on your side, on your back are the best ways to do it. And when you sleep on your back, if you do have a pillow underneath your neck, that's really good for helping with your snoring as well. I'm Dr. Jeff, and thank you for listening.